Hello friends, let us now learn some important MCQs on prevention of the disease. Pap smear test for detection of carcinoma cervix. In which level of prevention? See, diagnosis and treatment includes secondary prevention. So here with pap smear we are going to diagnose the carcinoma cervix. So this includes secondary level of prevention. Primary prevention for dental caries include fluoridation and dental health education. So that is specific protection. Primary prevention for dental caries includes health education. Then, which of the following is primordial prevention for non-communicable diseases? For non-communicable diseases, salt restriction in high non-communicable disease area is primordial prevention. Primordial prevention is the prevention which is done before the emergence of risk factors. Even before the risk factors occur, if we restrict the salt restriction, then that is primordial prevention. Preservation of traditional diet in low non-communicable disease area is primordial prevention. Actually, C is the best answer. A and C, both these are answers, but if you are asked to select one, then C will be better answer than A, because in primordial prevention there should be no risk factors. So if we are going to preserve traditional diet in low non-communicable disease area, is that area where there are no risk factors, then that is primordial prevention. Then primary prevention includes marriage counseling and immunization comes under primary prevention. Under primary prevention we have marriage counseling and immunization comes under primary prevention. Vitamin A prophylaxis to a child is specific protection. Vitamin A prophylaxis to a child is specific protection. Screening of diseases is which type of prevention? Screening of diseases is actually secondary protection. In secondary protection there is secondary prevention there is in secondary prevention there is diagnosis, screening and treatment of the disease. Then which of the following is not a primary prevention strategy? Primary prevention is done with when there are risk factors but no disease, then we do primary prevention. In the primary prevention there is health education and specific protection. The first one, breast self-examination is not a primary prevention. Breast self-examination is done for screening of breast cancer, so it is secondary prevention. Control of tobacco, radiation protection and cancer education, all these three comes under primary prevention strategies. Next question. Coronary artery disease, primordial prevention is done by. See, coronary artery disease primordial prevention is by decreasing the primordial prevention is done in the areas where there is less incidence or less risk factors. So lifestyle change is most commonly done in those conditions, in those areas where there are increased risk factors for coronary artery disease. So lifestyle change is a primary prevention. Coronary bypass grafting is the treatment of coronary artery disease. So that is secondary prevention. Treatment of coronary artery disease is also secondary prevention. So there is no primordial prevention given in this question. Next. Quarantine period for yellow fever in India is 6 days. Quarantine period for yellow fever in India is 6 days. Prevention of emergence of risk factors is primordial prevention. preventing the occurrence of risk factors itself is primordial prevention. Then, one of the following is an example of tertiary prevention. Tertiary prevention mainly includes rehabilitation. Vaccination is primary prevention. In the presence of risk factors, if we give specific protection against a disease agent, then that is primary prevention. Vaccination is primary prevention. Health education is primary prevention. Immediate diagnosis and treatment is secondary prevention, whereas rehabilitation is tertiary prevention. Which one of the following is not a waterborne disease? Strongyloidosis is not a waterborne disease, whereas giardiasis, MBBS and teniasis is a waterborne disease. Then, a person who has lost his foot in an accident and is not able to walk is an example of there is disability. So, there is impairment. See, if he has lost his foot, it is disability. See, accident is a disease. Loss of foot in an accident is disability. Not able to walk is impairment. Primary prevention of obesity is already there is risk factors. In the presence of risk factors, the measures which we take comes under primary prevention. The primary prevention, under primary prevention, we have high fiber diet. Then, next question. Primordial prevention in coronary artery disease includes exercise in high risk areas. Among the given options, that is better option. The thing is, BP monitoring is done whenever there is risk factors, right? So that is BP monitoring is done in the presence of risk factors. So that is primary prevention, or if it is done for diagnosis, then it comes under secondary prevention. Statins are the drugs which are given to control lipid profile. So among the given options, exercise in high risk areas is a better option. Then immunization is a primary prevention because it comes under comes under specific protection. Immunization is primary prevention which comes under specific protection. Iodized salt in iodine control program is primary prevention. In iodine deficiency control program, iodized salt comes under primary prevention. Target group in secondary prevention includes patients, because in secondary prevention already the disease has been occurred. So in order to prevent the disease, in order to prevent the progression of the disease, we should give treatment of the disease which comes in secondary prevention. So target group is patients. School health checkup comes under secondary prevention, because here with the help of school health checkup program, we are going to diagnose the children who have the visual acuity less than 6 by 9. So it comes under secondary level of prevention. Desk provided with tabletop to prevent neck problems comes under primary prevention. See, neck problems risk is present in these children, and here we are trying to remove the risk in these children. So that is primary prevention. Then which one of the following is the primary prevention? Vaccination comes under primary prevention. Prevention of emergence of risk factors include primordial prevention. Prevention of emergence of risk factors is primordial prevention. Iodine salt supplementation includes specific protection. Iodine salt supplementation is specific protection. All are health promoting strategies except C. Chemoprophylaxis is actually for the chemoprophylaxis is done for those individuals who have been exposed to a disease. It is not an health promotion strategy. It is actually a specific protection. Health promotion strategies are insecticide sprays, portable safe water, and lifestyle modifications comes under health protection strategies. So, thank you guys for watching my lecture. Thank you.